Hi, I'm Cheryl Kramer-Kay, the Executive Beauty Director for Shape Magazine. You know, over the years, my readers have asked me so many questions about BOTOX Cosmetic. And now, through this three-part video series, I'm going to answer those questions based on my personal experience. I'm not only someone who has been treated with BOTOX Cosmetic for these deep lines here, I also write about BOTOX Cosmetic for my job. The first time I went to the doctor for BOTOX Cosmetic, it had just been approved and I wanted to write a story about it. And I was also really starting to notice my frown lines. So much has changed in my life since I wrote that first story about BOTOX Cosmetic. I got married, I changed jobs, I had twins, and now I am juggling the life of a working mother. And it's sometimes really hard to find time for me in there. But the one thing I will always make time for is BOTOX Cosmetic. And the fact is, it doesn't take a lot of time out of my schedule. It's just a quick trip to the doctor, and let me tell you, it is worth the $15 extra for the babysitter. Over the years, when the lines come back, I can barely stand it. And I go to the doctor and get treated again, and I've really come to appreciate what BOTOX Cosmetic can do for me. As a beauty director, it's my job to be informed and objective about the treatments and products that are out there. And when I first started writing about BOTOX Cosmetic, I did my homework. I went to the experts, the dermatologists. I was absolutely blown away by what the dermatologists were showing. They had before and after pictures of frown lines, and the difference was amazing. And I thought, this is something that my readers need to know about. Over the years, many of my readers have told me how happy they are and the real results that they get with BOTOX Cosmetic. In my job, I see a lot of products, I hear a lot of promises, but the fact is, BOTOX Cosmetic has the science behind it to really do the job. So as you can see, these frown lines are back. They are deeper and I cannot stand it. So I'm heading back to my doctor for another treatment of BOTOX Cosmetic. So this time, I'm also going to ask my doctor about BOTOX Cosmetic for my crow's feet, because these things have gotten a lot worse. So now it's time for me to go see my doctor for a treatment of BOTOX Cosmetic. And in the next video, you will find me at the doctor. Maybe it's time for you to find a doctor and consider BOTOX Cosmetic. You can find one at BOTOXcosmetic.com.
BOTOX Cosmetic, onabotulinum toxin A, important information. Approved uses. BOTOX Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of both moderate to severe crow's feet lines and frown lines between the eyebrows in adults. Important safety information. BOTOX Cosmetic may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks after injection of BOTOX Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. If this happens, do not drive a car, operate machinery, or do other dangerous activities. The dose of BOTOX Cosmetic is not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when BOTOX Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, or both at the same time. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not take BOTOX Cosmetic if you are allergic to any of the ingredients in BOTOX Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of BOTOX Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, weakness of forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if BOTOX Cosmetic can harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if BOTOX Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using BOTOX Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received BOTOX Cosmetic in the past. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myobloc, Dysport, or Xeomin in the past. Be sure your doctor knows exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of BOTOX Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-433-8871. Please see BOTOX Cosmetic full product information, including boxed warning and medication guide, on this website.